Dzień dobry, witam Państwa serdecznie. I will switch to English because Professor Shmulewitz is not speaking Polish fluently. So my name is Małgorzata Minie and I'm holding PhD in pharmaceutical science. My expertise, I started as a pharmaceutical development expert in industry, pharmaceutical industry. I was developing classic drugs. And I had the possibility to move to Israel, where I was living 6 years, and I was developing pharmaceutical products based on medical cannabis. During this path, I also could learn about how this exceptional plant can be used for to improve the wellness of patients for the very complex conditions. I was building European markets to let help my former company Panaxia to enter the medical cannabis product to European countries. So I have also extended experience in regulation for medical cannabis. And on my path, I was very lucky to meet Dr. Shmulewitz, with whom we are working together on development of medical cannabis products. And today, during this session, we'll be discussing several points to explain you maybe from the start the history of medical cannabis, and also some base how endocannabinoid system was discovered, who was the leader, pioneer here. And Dr. Shmulewitz has a very specific and unique profile because he was working with Professor Mechoulam, who was the father of medical cannabis. This is exactly how it's described in even Wikipedia if you are searching about Professor Mechoulam. So I'm very pleased to welcome here with me Dr. Ascher Shmulewitz. So Dr. Shmulewitz, please kindly introduce us your unique profile and maybe explain how you enter in medical cannabis and how you could meet Professor Mechoulam on your path.
Thank you, Dr. Miner, and thank you for all of you attending this morning. My Polish is not as good as your Hebrew, so I will speak in English. My father was born in Poland, actually. I met Professor Mechoulam in the early 2000s. I was developing a new device. My background is a physician, scientist, a cardiologist, and a PhD in engineering. And I was developing a new approach to treat cardiovascular disease, and I was looking for a drug to put on a stent on a scaffold for blood vessels. And I heard about Professor Mechoulam. He was very famous already at the time in Israel and in the world. And we became friends, and it was a real joy to work with him. So thank you for listening to my story, his story. Thank you.
Okay, so let's start with a bit history for context. Our audience, we know, are most of them medical doctors. So we know that medical cannabis was used from millennia, from ever. We have even the mention in the Bible about medical cannabis. And the history or the research started in the 60s with the team of Professor Mechoulam, who was the first to identify the THC as a key compound in medical cannabis responsible for high when we are using medical cannabis plant, and also CBD. So those two primary compounds were the beginning of the current research in the field of medical cannabis field. Could you explain us from your own experience with working with Professor Mechoulam, how it started? How was Professor Mechoulam? How was his lab and all the details of your collaboration? Because it's very interesting to know how the history started.
Sure. So, first of all, Professor Mechoulam was a very interesting and delightful individual. I met him when he was already in his mid-80s, so I didn't have a chance to meet him when he was younger, but he was very young in spirit, maybe because of the cannabis. So he had an office that always had a very strong smell of terpenes and cannabis, so he had a lot of students in the pharmaceutical industry that came to work with him because they thought they maybe were able to get some of the cannabis from him. He had a safe in the building, and the cannabis that he had was always from confiscated hashish and cannabis from the police. One of the stories that he liked to tell is that when he just started, he was one of the few in the world that was able to do research on cannabis and get funding actually from the U.S. government to do research on cannabis. So even though the U.S. government was against cannabis, it actually has many patents in cannabis. So it's interesting that the U.S. government was interested in the research related to cannabis. And so he told the story that he would take the cannabis from the police and ride a bus back to the university, and everyone was asking him what was the very strong smell coming from his bag. So that was an interesting story about him. He always had new ideas and different uses for cannabis, which was a pleasure. And what surprised me is that I finished medical school in 1983. And no one talked about it then, even though THC and CBD were discovered many years earlier.